In this video, we will take a closer look at the key indicators from Section 1 of the RCGP Standards for General Practice. This is looking at the 4th edition. This section has 7 standards, including access to care, information about the practice, health promotion and prevention of disease, continuity of care, coordination of care, and content of patient health records. We won't cover all criterions and indicators within each standard because otherwise this course would become much longer than would be practical. But instead what we'll do is we'll focus on the areas that generate the largest number of questions. We'll look at those indicators that may lend themselves to misinterpretation and also those presenting the biggest challenges for practices. You will also notice as you go through the standards that some have a triangle which represents that those indicators are required, and some don't have the triangle, which means those indicators are recommended but not essential in order to successfully gain an accredited status. The key criterion and indicators worth a special mention as part of this section include Criterion 1.1.1, Scheduling Care in Opening Hours, which covers requirements for triage procedures or how the practice prioritizes patients depending on urgency and need. The downloadable staff training sheets located in the resource guide offers guidance for staff education in this area. Criterion 1.1.3, Home and Other Visits, requires we have document evidence that doctors within the practice perform home and other visits, such as either hospital visits, aged care facility visits, and for this it's a good idea to make a note of some of these patients close to the accreditation visit date. So this will make it easier for the surveyors to cite evidence of how you meet this indicator based on progress note entries in some of these patients' files. Criterion 1.1.4, Care Outside Normal Opening Hours, looks at the after-hours arrangements for your practice. If you use an after-hours locum service, make sure you get a statement letter from them to show this as part of your accreditation visit. Criterion 1.2.1, Practice Information, refers to information you include in your practice information sheet. You can also find a list of requirements in the explanation text for this indicator. Criterion 1.2.2, Informed Patient Decisions, refers to information you make available to inform patients about services and to explain different conditions. This is most easily addressed by providing relevant patient brochures and fact sheets, which could be available in the waiting room. Also check you have information available in other languages, as the surveyors are likely to look for this. Criterion 1.2.3, Interpreter and Other Communication Services. With this, all staff should be trained on the use of interpreter services and their contact details should be easily accessible. The staff training sheets, again, that resource provides some helpful information on this topic. Criterion 1.4.1, Consistent Evidence-Based Practice. This indicator is about making sure your providers have access to current clinical guidelines. These are most readily available in electronic format from the RCGP website. Criterion 1.5.1, Continuity of Comprehensive Care and the Therapeutic Relationship. Your practice must make sure that patients can request to see their own GP. You must also demonstrate how you encourage patients to book with their usual GP. Criterion 1.5.2, Clinical Handover. Now with clinical handover, this is looking after handover of patients, which can take place either face-to-face, in writing, via telephone, but also by electronic means. This covers instances where the GP may be covering a fellow GP who is on leave or who is unexpectedly absent, or a GP covering for a part-time colleague, a GP handing over care to another health professional, such as a practice nurse, a physiotherapist, podiatrist, or psychologist, or a GP referring a patient to a service outside of the practice or a shared care arrangement. Criterion 1.5.3, System for Follow-up of Tests and Results. Now, your practice must be able to demonstrate how all pathology results, imaging reports, investigation reports, and all clinical correspondence that's either received by the practice or performed by the practice has been reviewed by a GP and signed or initialed or the electronic equivalent. You must also demonstrate that, where appropriate, this has been acted on in a timely manner. For example, if the patient's been required to return to the practice for discussion. You must also have a documented system to identify, follow up, and recall of patients with clinically significant results. Criterion 1.6.2, Referral Documents. All referral letters must be legible. They must contain at least 3 approved patient identifiers. They should state the purpose of the referral, and where appropriate, they should be on practice stationery. They must also include relevant history, examination findings, current management, list of known allergies, adverse drug reactions, and current medicines. The practice must ensure that if referrals are going to be transmitted electronically, that this is done in a secure manner and that a copy of the referral document is always retained in the patient record. Criterion 1.7.1, Patient Health Records. Your practice must demonstrate that you routinely record the person that patient wishes to be contacted in case of an emergency. Note that this is different from next of kin, so make sure your patient registration form is collecting emergency contact information as well. Your practice must be able to demonstrate that you routinely record Aboriginal and Torres Strait Islander status as part of your active patient records. Criterion 1.7.2, Health Summaries, dictates that at least 90% of your active patient health records have allergies recorded, and that at least 75% of your active patient records contain a current health summary. This summary should include, where appropriate, adverse drug reactions, current medicine list, current health problems, relevant past history, also health risk factors such as smoking or alcohol intake, immunizations, any relevant family history, as well as relevant social history, and you must also include cultural background where clinically relevant. Criterion 1.7.3, Consultation Notes. Now with this indicator, it often catches many practices off guard. Your patient consultation records must include consultations outside of normal opening hours, evidence of home and other visits, and also evidence of telephone or electronic communications that have taken place. They should also include the date of the consultation, the reason for visit, clinical findings, diagnosis, any recommended management, and also if there's going to be a process of review, that should also be listed. It must include any medicines that were prescribed, any preventative care, and if there were any referrals to other providers or health services. There must also be evidence that problems raised in previous consultations are followed up in subsequent presentations. In the next video, we'll discuss in more detail key standards from Section 2, Rights and Needs of Patients.